Hi, good morning, and welcome to the Sunday Journal. I'm Carrie Steele, and our guest this morning is Dr. June Chen. And Dr. Chen is the medical director at breast radiology at BreastLink, Breast Care and Imaging Center of Orange County. And I was just talking to Dr. Chen off the air about some personal things because October is Breast Cancer Awareness Month, and I think as a woman, we all have to think about these things. We're getting so many different messages about when to get a mammogram and what are some of the signs of breast cancer. So we're talking to Dr. Chen this morning, hopefully getting answers to those questions, and we so appreciate your time this morning, Dr. Chen.
Thank you for having me.
So yeah, let's start there. Breast Cancer Awareness Month, and that's just, again, to drive home that message that, hey, if you think you feel something, if something doesn't feel right, go to a doctor, right?
Absolutely. In fact, some of the common signs and symptoms of breast cancer are important for women to know just so they're aware when they're doing their self-breast examination. If a woman feels a lump in her breast or some thickening or maybe notices some skin changes with puckering, or even a nipple discoloration or some flakiness, or nipple discharge, which is some leaking of the liquid from the nipple. Those are all signs that women should be aware of, and if they notice any of them, they should seek medical attention and talk to their doctor about it, because more than likely a mammogram and perhaps even an ultrasound or other studies will be needed for further evaluation.
Now, there's been some changes in when it's suggested that you get a mammogram. It used to be starting at maybe 45. Then we heard 50. Then we heard, it's better to err on the side of caution. When exactly is the best time? Or is it just, when you might feel that you should get something checked out?
So, Carrie, I'm so glad you're bringing this up because I know that there is a lot of confusion among women right now.
Mm-hmm.
And that's because there's been a lot of controversial media news out there in the last several years. And so I'd really like to take this time to clarify.
Perfect.
So at BreastLink, which is a breast-dedicated facility, the guidelines that we follow are those that are set forth by every major medical organization that has expertise in breast cancer care. These organizations include the American College of Radiology, the Society of Breast Imaging, the American College of OBGYN. The guidelines set forth by these medical organizations recommend that every woman start receiving screening mammograms at age 40.
Okay.
And this is for the average risk woman. Now, bear in mind, if one has a higher risk for development of breast cancer, which we can talk about later on if there's time for that, they may even need to start earlier. But for the average risk woman, it's very important to start receiving your mammograms at age 40. And then these organizations recommend that the women have mammograms on a yearly basis thereafter. And there's really no cutoff to when we should stop. It really depends on the health of each individual woman.
Interesting. Now, has that been the information that you've been using ever since you got into the field? Because like you said, we've gotten mixed messages is, I guess, the best way I can put it. But as far as you're concerned, is that always the guidelines you followed? You tell your patients 40?
It has been, yes.
Okay.
And I've been practicing breast radiology for over 18 years. And all through my training, even before going into practice for 18 years, what we were taught in all of my training, which was a breast fellowship training in radiology, the indication and the guidelines were to begin screening mammogram at age 40 and to continue thereafter on a yearly basis.
Okay. Yeah, it seems strange to me that we would even be debating it because what's the harm?
Well, interestingly, some of the harms that have been talked about are the anxiety to women. Mm-hmm. So, in other words, if one were to receive a mammogram and then they receive a letter from the facility stating that there's an area that needs to be worked up some more, the women may experience anxiety and fear, which is absolutely understandable. We all would feel that. And so that's quoted as a harm. However, if you think of the risk that leads to finding an early breast cancer, which ultimately saves your life, I think that anxiety is worth it. And even in cases where it ultimately proves not to be a breast cancer, and so the anxiety was therefore maybe unnecessary, even when those women are interviewed, most of those women do state, it was worth it. I'm glad that I underwent all the tests, and now I know I have healthy breasts, and it was scary, but it was worth it.
Well, absolutely. In my mind, it's preventative. You're just making sure you're checking it off the list. It's one of the things we should all do, and we don't. We know we neglect probably the things that we should do to stay the most healthy, but it still seems to me it's preventative. So why wouldn't you do it? But are there other prevention methods or screenings for breast cancer?
So there are other screening examinations for breast cancer. None of them replace a screening mammogram.
Okay.
I just really, really want to stress. Screening mammograms are wonderful. They're really the gold standard for the early detection of breast cancer. And in no subset of population should another screening test replace a screening mammogram. However, there are some women who have a higher risk of breast cancer, some specific subset of population which may require an additional screening examination in addition to the mammogram. And these include a screening breast ultrasound or a screening breast MRI examination. And these need to be determined on the basis of the individual, and whether or not these are indicated should be determined by the woman's physician.
Well, and you talked about women maybe not going to get the mammogram and really wanting clarity on when the best time to do it because of anxiety. Has that lessened, though, with, the advancement in technology? I would think, gosh, it seems to me the mammogram images now are just so much different than what we were doing 20 years ago. I'm guessing they're less likely to be false positives or things that looked concerning.
The technology advancements have been amazing. It's been wonderful. The images or the pictures that the radiologists are studying are so much clearer nowadays. We can definitely find earlier cancers. We can see abnormalities clearer and easier. There's no question. So that's just been wonderful.
Right. And you just we're talking also about people that are maybe of greater risk of breast cancer. Maybe it's hereditary. For example, if there was a history of breast cancer in my family, how could I get a test to find out if I am at greater risk?
So there are a lot of programs in our community where there are specialized health professionals who take a very detailed history of both the family as well as your personal history, and they determine what your lifetime risk for development of breast cancer is. And these healthcare professionals are called genetic counselors. And so one can usually find a genetic counselor in the community. We here at BreastLink offer a risk assessment program. We have a dedicated genetic risk assessment individual who does this. And once one's lifetime risk is determined, then a better plan of action can be made. And so, for instance, if a woman's lifetime risk for development of breast cancer turns out to be greater than 20%, then all insurance companies, for the most part, will pay for the addition of a screening MRI examination in addition to your annual screening mammogram.
Well, I guess probably the most public case we know about is when Angelina Jolie, I guess she was diagnosed, and because there was such a profound history of breast cancer in her family, she just opted for the double mastectomy. Is that kind of the thing we're talking about here? If you have to see if you are at higher risk, and so maybe you're just going to do something that maybe a little dramatic, a little drastic, but otherwise you're at great risk.
Yes, absolutely. And Angelina Jolie, as far as I understand it, she also tested positive for the breast cancer gene, which you may have heard of. Mm-hmm. And so there are tests in addition to test to see if one has that. That has also been referred to as the breast cancer gene mutation. It's also known as BRCA1, BRCA2 gene mutation. So there are a lot of different titles for it, but all basically refers to the breast cancer gene. Now, if one tests positive for the breast cancer gene, she is at a much, much greater risk to develop breast cancer. And not only develop breast cancer, but also develop ovarian cancer.
And ovarian cancer is really hard to detect, isn't it?
It's very hard to detect.
Yeah.
So this information is very valuable because it will really place the woman at higher surveillance for the development of breast cancer or ovarian cancer. And if the patient or the woman chooses to have preventative surgery such as double mastectomy, which I believe is what Angelina Jolie had, that will be available to them as well. I do want to make a very, very important point, which is although any woman that has a gene mutation is at a very, very high risk to develop breast cancer as compared with the average population, I just do want to stress that most breast cancers develop in women who have no family history of breast cancer. Greater than 75% of breast cancers develop in women who have no family history of breast cancer. Only about 5 to 10% of breast cancers are actually in women who have the breast cancer gene.
Wow.
Mm-hmm.
I mean, I don't even know how to react to that besides wow, because I don't think I've ever heard that before.
Yes, and I really want to stress that because I often hear when I'm out and about, oh, I don't have a family history of breast cancer, so it's not that important for me to go and get my mammogram every year. But as I just really stressed, that's not true. In fact, what I want to stress is that the two greatest risk factors for the development of breast cancer is simply being a woman and aging. And so that's going to include all of us who are women.
Why is that? Why does age have anything to do with it?
There haven't been any solid reports of exactly why, but in general, as we age, it is more difficult for our DNA to repair when there are breaks or mutations that occur spontaneously.
Does it have anything to do with hormones?
Well, many breast cancers are hormonally driven and hormonally dependent, but not all are.
Mm-hmm. Okay. Gosh, that's mind-blowing what you just said. And I know for me, because I was sharing with you some personal information off the air. I don't have any problem telling people that I have a history of cysts in my breast, and I usually get them drained after, they get large enough that they're uncomfortable. But that is the exact rationale in my mind when I can feel them. I know when they start to get a little large and I need to go get them checked out. But I've always kind of given myself this, you know what, there's no history of breast cancer in my family anyway, so it can't be anything worse than just a cyst. But from what you're saying, I've been a little foolish.
It's just misinformation, and that's what I'm here for, is to educate women and get women to come in and get their mammogram because they are life-saving examinations. And no woman is immune. And another misconception that I've heard a lot is, I have breast implants, so therefore I cannot get a mammogram. And that, again, that's false. Every woman needs to come in and get their mammogram. And even with the implants, we do some special views to try to displace and move the implants out of the way. But the mammogram is not going to hurt your implant, and you still need to get in and get your mammogram. At
the top of the interview, you were talking about self-examinations. And I know, again, a few years ago, you heard about that a lot more than you seem to hear anymore. Is that accurate?
Unfortunately, I believe there's a lot of controversy regarding self-breast examination as well as clinical breast examination in recent years, along with the screening mammography guidelines. At BreastLink, we do still recommend that every woman perform a self-breast examination on a monthly basis because just anecdotally, we have a lot of patients who picked up their breast cancers on their own. So we feel that it is important to do so.
Yeah, especially because if you detect something that doesn't feel right, it's it's like a no-brainer. I mean, the earlier the better, right?
Yes, and Carrie, that's a great point because earlier in this interview, I went over some of the signs and symptoms that one may see if they have breast cancer. But I think very importantly is every woman knows her breast the best. So if she detects a change, even if it's not one of the ones that I mentioned earlier in our conversation, if there's simply a change to the breast, she needs to bring that to the attention of her doctor.
Yeah.
And that needs to be investigated.
This is so much great information, but I want to make sure we're not misleading people here thinking, maybe if you feel something, you should go get a mammogram, or if there's a family history, you should go get a mammogram, because really this is something that you should do regularly, whether there's warning signs or not, right?
Yeah, so absolutely, Carrie. Every woman over the age of 40 should be receiving a mammogram, even if she has no signs or symptoms. That is the very least. If she has signs or symptoms, she should seek immediate attention with her doctor.
And again, for the very simple reason that early detection increases your chances of successful treatment.
Early detection is the key to less invasive surgery, less likelihood to need chemotherapy, a higher quality and better quality of life, and increased chance of survival and cure.
So maybe this is where we should talk about the different stages of breast cancer, because I know there are different stages. So can you walk us through that and how important it is if you could detect breast cancer at, do they even have I think I've heard 0 stage.
There are multiple stages of breast cancer, and they do range from stage 0 to stage 4.
Okay.
And these stages are basically determined by tumor size, lymph node involvement, and when I say lymph node involvement, I mean, are the lymph nodes in the armpit involved with breast cancer? And then finally, they have to do with whether or not there's metastatic disease. And by that, I mean, is there spread of the breast cancer to distant organs? And this could be the liver, the bone, the brain, the lung.
Wow.
And that's how the different stages are determined. And definitely, in general, the lower the stage, the better the prognosis. The higher the stage, the poorer the prognosis.
All right, well, let's talk about some of the treatment options then. We were talking about mastectomies, obviously, and that's a little dramatic. What are some of the other things you can do if you have been diagnosed? How are the different things you do to treat breast cancer?
So standard of care is there will be some type of surgery, whether it's a breast-conserving surgery with a lumpectomy or a partial mastectomy or a full mastectomy. In addition to that, one may need to receive radiation therapy. In addition to that, one may or may not need chemotherapy. And the decision as to what a patient needs is really determined by their stage and the type of breast cancer. And there are many, many different types of breast cancer. Breast cancer is a very heterogeneous disease. What that means is that the breast cancers can vary in the types of hormone dependency, the genetic makeup of the actual breast cancer cells. There's a lot of different types of breast cancer. It is not just one homogeneous disease.
If it's suggested that you get a lumpectomy, does that also mean radiation?
Ordinarily, radiation does occur with the surgery. However, as I had said a little bit earlier, it really is individual.
Okay.
In other words, if a patient has stage 0 and a very, very small stage 0 breast cancer, and it's early, and they're able to just get a very large clear surgical margin, perhaps in the specific case she may not need radiation. And so it really needs to be based upon each individual and their type of breast cancer, as well as their age and what they're able to tolerate.
I'm just going to ask this question because I really don't know, and maybe a lot of people listening don't know either. If you're getting a radiation treatment, what does that consist of?
So there are different types of radiation. There are now intraoperative radiation as well as external beam radiation. And there are dedicated physician experts called radiation oncologists who specialize in this field in determining what's best and which patient should get what.
So when I introduced you at the top of the interview, I said you're the medical director of breast radiology at BreastLink. And why don't you talk to us about BreastLink? Because I noticed here that there's a lot of locations. And like I said, I shared some personal information with you. So I think I'm going to be going to see you at your center in Newport Beach. But can you tell us a little bit about BreastLink and their services?
I would love to. BreastLink is a group of freestanding, multidisciplinary breast health centers. So what that means is that all of the breast expert physicians are located in one building under one roof. And that would include your breast radiologist, which is what I do. I interpret mammograms and am dedicated to the early detection of breast cancer. And then we have the breast surgeon. And then we have the breast medical oncologist, which I sort of touched upon, who is a specialist in chemotherapy medications for our patients. And then there's the breast plastic surgeon in our practice as well, if his services should be needed.
Wow, so I guess there's a huge advantage to having all of these specialties in one place.
Absolutely. So we feel that it makes for a very comprehensive practice, and it allows coordination and an organized team approach. It really makes it so much easier for our patients. Things won't fall through the cracks. They don't have to drive from building to building. They don't have to call the doctors and make sure that all the doctors are talking. In our practice, all the doctors are talking. In fact, once a week, our interesting cases and our newly diagnosed breast cancer cases are discussed at a conference where all of the doctors are present, so that a very dedicated, individualized plan can be made and followed through for each patient.
Gosh, that's so important because, yeah, you're getting life-changing information if you're diagnosed with breast cancer. And part of the traumatic experience is, like you said, you got to go from one doctor to another, different buildings, different parts of town. This just sounds a perfect scenario in an unfortunate situation.
We've gotten a lot of positive feedback, and that's what's really propelled us to move forward. And as you had mentioned, now we have 6 locations, and we're finding that our patients are very happy and they're feeling very well taken care of.
Well, if there are people listening that are saying, I wonder where these locations are, let's go ahead and throw those out. I know you guys are in Newport Beach.
Yes, so I'm located in Newport Beach. We also have locations in Orange, Laguna Hills, Garden Grove, Temecula, and Encino.
And is there just one general web address where somebody can go to get more information about BreastLink and then find out about the different locations?
Yes, and that would be breastlink.com.
Easy. Breastlink.com. We'll have this on the Sunday Journal page, too. If there's people listening, it is early on a Sunday, and they may not have a pen while they're having their coffee. So just go to the Sunday Journal page at our website there, too. And I know BreastLink is owned by RadNet, I guess. I read this, and they're opening a cancer institute in the San Fernando Valley. Is there information that you wanted to share with our listeners about that?
Well, RadNet is thrilled to be opening the Integrated Cancer Institute, and that'll be in early 2017. It's a gorgeous, new, state-of-the-art medical center in the San Fernando Valley, and it will include all services from prevention to screening mammography to screening for other types of cancers, all the way through to successful completion of treatment. And this is for all cancers.
You know what, Dr. Chen, this has been so beneficial, all of this information about things you could do, early detection. But how about prevention? We talked about prevention methods or screenings for breast cancer, but what else can a woman do?
Well, that's a great question. There is no single action or thing that any woman can do to prevent breast cancer, unfortunately. However, the good news is there are definitely things that we can do as women to reduce our risk of developing breast cancer. And they're basically all the things that we've heard about healthy lifestyle habits. And those would include exercise, and that means maintaining a good body mass index, not being obese, eating well, taking in alcohol in moderation. It's really been proven that if a woman drinks 3 glasses of wine, she is at a higher risk to develop breast cancer than if she's taking in less than 2 glasses a day. And also, there's also been evidence to show that vitamin D is important.
Okay, so you talked about alcohol in moderation. Are there other foods that maybe we should stay away from or limit our intake of?
Well, I think it all goes back to the healthy lifestyle of increase your fiber, protein is good, stay away from starches and fatty foods, and basically have a well-balanced meal.
Makes total sense. I so value your time, and you've been so generous, and you've given us great information. Is there anything that we didn't touch on or something that you want to reinforce as we leave our listeners to go on about their Sunday?
I'd really like for all the women to take home this message. If you're a woman and you're over the age of 40 and you haven't gotten your mammogram this year, please get in and get it now. It could save your life.
So great to talk to you. Thank you so much for coming on the air with us this morning and sharing all of this really valuable information. Have a wonderful day.
Thank you.